Hi everyone, welcome back to my channel. This is Dr. Zina speaking. Today we will be talking about what is adenomatoid odontogenic tumor. But before we continue, make sure to press the like button down below for more and more videos. So let's start now. Adenomatoid odontogenic tumor originates from the remnants of the dental lamina, so it is odontogenic origin, which means that it is tooth-related problem. It is also known as two-third tumor. Why is that? Because two-thirds of the cases can be seen in the maxilla. So two-thirds of the cases of adenomatoid odontogenic tumor can be seen primarily in the maxilla. The causes, as I said, it is an odontogenic cyst, odonto, so it is tooth-related problem. And sometimes it may arise with an unerupted teeth. So if the patient came to you and he tells you that my teeth are not erupting, it may be the cause behind it. So it is similar to dentigerous cyst in this case. But of course, we need to differentiate it from dentigerous cyst, which I will say the difference between them in a couple of seconds. So as I said, the symptoms, there will be a painless swelling. So the patient will not complain of any pain and missing permanent teeth. Why my permanent teeth are not coming out? These are the most common symptoms the patient might tell you. So here is a picture, a clinical picture showing an expansion can be seen in the maxilla. Patient came complaining of the of his lateral incisor. Why it's not going or aligned with the teeth. As you can see, there is a palatal displacement of the lateral incisor associated with the large painless swelling that you can see in the picture. And this swelling is associated with the adenomatoid odontogenic tumor, which is tooth related. Here is an OPG that was taken for one of my patients, showing that the lateral incisor and the first premolar, they are drifted in such a way that the space is closed completely, and because it is closed, you can see clearly that the canine did not erupt yet. Why is that? Why it did not erupt? Because we have a large unilocular radiolucency causing dilaceration for the roots of the lateral incisor and the first premolar, closing the space to allow the tooth to erupt. So the radiographical pictures, asymptomatic, discovered during radiographic examination, or to know why a tooth hasn't erupted yet. Larger sizes of the lesion cause painless expansion of the bone. 75% of the tumor appears as unilocular radiolucency involving the crown of an erupted tooth, most commonly is the canine is affected. So if the canine is missing, it might be the cause behind it, adenomatoid odontogenic tumor. Now, we need to differentiate the adenomatoid odontogenic tumor from the dentigerous cyst. How to differentiate between them? Both of these are associated with interrupted teeth. But the adenomatoid odontogenic tumor are not always associated with any erupted teeth. It might appear with no reason behind it, and it is not associated with any erupted teeth. Okay, whereas the dentigerous cyst, it is always associated with an erupted teeth. Commonly, the third molar, the unerupted third molar. If you see a radiolucency there, this is the dentigerous cyst. Now, here is another way to differentiate the adenomatoid odontogenic tumor from the dentigerous cyst in the terms of radiolucency. In terms of radiolucency, for the adenomatoid odontogenic tumor, the radiolucency extends up to the apex of the tooth. So the whole tooth there will be a radiolucency that is covering it. In comparison with the dentigerous cyst, which I will show you a picture, that you will see the radiolucency is only covering the crown of the tooth, not the apex or the root. As you can see in the picture, we have a radiolucency surrounding the unerupted third molar, and this radiolucency is only involving the crown of the tooth, not the apex or the root. This is the dentigerous cyst. So this is how to differentiate between the adenomatoid odontogenic tumor to the dentigerous cyst. Here is another picture showing a small radiolucency, an oval-shaped radiolucency located between the lateral incisor and the canine area. Between the roots of the lateral incisor and the canine area, we have a small radiolucency. This confirms that we can see the adenomatoid odontogenic tumor not associated with the unerupted teeth. Here the teeth are fully erupted and we have this type of tumor. Here is a picture for one of my patients after we removed this large tumor from his mouth. The adenomatoid odontogenic tumor that is of epithelial origin, it is completely benign tumor. Remember that any tumor that is of epithelial origin, it's not yet going into the connective tissue or the subepithelial or of all of these layers, it is completely benign tumor. Anyways, since it is completely benign, do we do treatment for it? Yes, of course, because the patient will have a large swelling, and in addition to that, he will complain why my permanent teeth does not erupt. So we just carefully remove it. It is easily inculated from the bone. What do I mean by inculated? Meaning that removing it, excision, taking it out from the bone, carefully removing it so that you won't hit the roots of the adjacent teeth. That's it, I am done. Thank you all for watching my video. Don't forget to press the like button if you enjoyed the video and subscribe for more and more videos. Goodbye now.